order. Good morning, everyone. Alia, please take the roll.
Chair Kim,
Here.
Rep. Abney,
Designation.
Brennan,
Designation.
Cephas,
Designation.
Gergley,
Designation.
Haddock,
Designation.
Kozarowski, Malagari,
Here.
Mirsky,
Here.
Monroe,
Here.
Parker,
Designation.
Scott,
Designation.
Warren,
Designation.
Chair Pickett,
You forgot me. Sorry, I'm here.
Venkat,
Okay, here.
Oh,
Chair Pickett,
here.
Fink, Kutz, Ledbetter, Nelson,
Designation.
Mahalik, Miller,
Designation.
Olsummer, Rader, Rowe, Zimmerman.
On leave.
Thank you, Alia. We have a quorum. The first order of business is consideration of House Bill 2268. Representative Venkat seconds. Joe, please explain the bill.
House Bill 2268 requires health insurance, Medicaid, and CHIP to cover speech therapy for stuttering.
Thank you. We have the prime sponsor of the bill, Representative Markosik, here with us today. Representative, would you like to say a few words to the committee?
Yes, thank you, Chair Kim, Chair Pickett. I'd like to start by saying that I'm a person that does speak with a stutter. So this bill is very personal for me. I've spoken with a stutter my entire life, and I haven't let it define who I am. Some days are good, some days are bad in terms of my speech. So what we're doing today can really help a lot of people down the line in terms of providing speech therapy, especially for kids. Childhood onset stuttering, where it can get caught in children, particularly between the age of 2 and 6, can really prove to be a really crucial time when it can get caught and it can get treated, where most people end up growing out of a stutter by age of 18. However, not all do, like myself. And I could talk a lot longer about this. It's something I'm very passionate about. But I would just like to thank the committee today. And I think I would just like to end with this. Today, it's about breaking the stigma around stuttering while also providing tangible change and help for people. So with that, I would just like to say thank you, Chair Kim, Chair Pickett, and staff. So thank you very much.
Thank you, Representative Markosik. Now, there's one amendment to the bill. I offer Amendment A04605. Representative Venkat seconds. Joe, please explain the amendment.
Amendment A04605 removes Medicaid and CHIP from the bill. The amendment also limits the mandate to childhood stuttering, which is sometimes subject to developmental disorder exclusions. Coverage will be subject to the terms and conditions of a health insurance policy.
Thank you. Any comments, Madam Chair?
And thank you, Madam Chair. No comments on the amendment, but I will be supportive.
Is there any discussion on the amendment? Are there any negative votes on the amendment? Hearing none, Amendment A04605 is amended into the bill. I move to report House Bill 2268 as amended. Representative Mirsky seconds. Any comments, Madam Chair?
Supportive. I'm sorry. Thank you for helping me out with that. I have no further comments, but I will be supportive.
Thank you, Madam Chair. Is there any discussion of the bill? Representative Malagari.
Thank you, Madam Chair. I just want to thank the maker of the bill for a very thoughtful piece of legislation, and I understand that those with any bit of speech impediment or stuttering or any kind of speech issue that you need therapy for, this is a very needed piece of legislation. I thank you for putting it forward and being so passionate about it, and thank you for your advocacy. Thank you, Madam Chair.
Thank you. Any other discussion, comments on the bill as amended? Are there any negative votes on the bill? Hearing none, House Bill 2268 is reported from the House Insurance Committee unanimously. Congratulations, Representative Markozic.
Thank you very much. Thank you.
All right, the next order of business is consideration of House Bill 1140. Representative Abney seconds. Joe, please explain the bill.
House Bill 1140 requires health insurance and government programs to cover contraceptive care without cost sharing. The bill also provides for religious exemptions and confidential communications.
Thank you, Joe. We have the prime sponsor of the bill here today, Representative Kruger. Representative, would you like to say a few words on the bill, and would you be staying to answer questions on the amendment?
Yes and yes, Madam Chair. To Chair Kim, Chair Pickett, and the members of the House Insurance Committee, thank you for bringing House Bill 1140 up for a vote today. I first introduced a similar bill almost 4 years ago in August of 2020, and I've introduced it every session since then. We've worked very hard over the past year to negotiate the language of this bill, and the amendment that you will be voting on today reflects a compromise. I thank all of the stakeholders for their hard work to get to this moment. Simply put, this bill protects and codifies access to contraceptives here in Pennsylvania. That's why we named it the Contraceptive Access for All Bill. There are currently no protections in state law for contraceptive access, and we need to make sure that Pennsylvanians have access to the medications that they need. Contraceptives are used to prevent unplanned pregnancies, but they are also used to treat other medical conditions. Research shows the clear non-contraceptive health benefits of these medications, including decreased bleeding and pain with menstrual periods, reduced risk of gynecological disorders, endometriosis, pelvic inflammatory disease, and decreased risk of endometrial and ovarian cancer. A significant percentage of contraceptive users in the United States use contraception for a reason completely unrelated to preventing pregnancy, such as regulating one of the medical conditions I just named. Insurance coverage of contraception is critical to ensure that people can access and benefit from contraceptive care. Unintended pregnancy rates are highest amongst those who are least able to afford contraception, particularly those who face additional barriers to accessing health care services, including economic instability and discrimination. The Contraceptive Access for All Act will put a stake in the ground and say that here in Pennsylvania, you and your health care are protected. Through this critical legislation, the people of Pennsylvania will be protected and will ensure continued access to the contraceptives they need to plan and space pregnancies and decide if, when, and how to become pregnant now and for future generations. Thank you.
Thank you, Representative. Now, there is one amendment to the bill. I offer Amendment A04610. A04460. Representative Kozarowski seconds. Joe, please explain the amendment.
Amendment A04460 largely contains technical edits to ensure the bill conforms with federal law. Health insurers and government programs must cover contraceptive care without cost sharing, including a 3-month initial fill and 12-month refill of prescription contraceptive drugs. Health insurers and government programs may impose utilization management consistent with federal and state law. The bill also provides for confidential communications, a standing order for over-the-counter emergency contraception and over-the-counter oral contraception, and a religious exemption.
Thank you, Joe. Any comments, Madam Chair?
Thank you, Madam Chair. I have no comments on this amendment, and I will be supportive. Thank you.
Thank you. Is there any discussion on the amendment?
So the number of the amendment now is,
Oh, yeah, let's clarify the amendment number.
4610.
4610.
Okay, so we're going to go back to the original number, A04610.
Thank you.
Thank you for clarifying. Any discussion on the amendment? Are there any negative votes on the amendment? Hearing none, Amendment A04610 is amended into the bill. I move to report House Bill 1140 as amended. Representative Venkat seconds. Any comments, Madam Chair?
And thank you again, Madam Chair. I will support the bill with the language as amended. I do understand there were stakeholder groups that offered comments on the amendment, and I do encourage the majority to address those concerns as this bill moves forward, and I thank you.
Will do. Thank you, Madam Chair. Is there any discussion on the bill as amended? Are there any negative votes on the bill? Hearing none, House Bill 1140 is reported from the House Insurance Committee unanimously. Thank you, Representative Kruger. There being no further business, this meeting is adjourned. Have a great day, everyone.